Hi doctors, my name is Dr. Lama and the topic today is ventricular fibrillation children. The definition: ventricular fibrillation is rare in pediatric population, when it does occur. Ventricular fibrillation is usually the generation of other malignant arrhythmias, such as ventricular tachycardia. The period of arrhythmia may not be extensive, but ventricular fibrillation that occurs with a few initial beats of ventricular tachycardia is unusual.
The heart usually beats about 60 to 100 beats per minute. With each beat, your heart pushes blood throughout your body. The upper chambers of the atria contract at the same time. Then the lower chambers, the ventricles, contract at the same time. Ventricular fibrillation often starts with a fast rhythm in the lower chambers of your heart, called ventricular tachycardia. It is caused by a problem in your heart's electrical system. Ventricular fibrillation is a very fast rhythm in which your heart beats 200 to 300 times per minute. When your heart beats this fast, it is merely quivering rather than actually beating. Less blood and oxygen is pumped to your body and, most importantly, to your brain. Ventricular fibrillation is the most dangerous arrhythmia because it often leads to sudden cardiac arrest and sudden cardiac death.
This is an example of a fibrillation ventricular. Application in medicine. Primary ventricular fibrillation is uncommon in children. In a study of pediatric hospital arrest, ventricular fibrillation was the initial recorded arrhythmia in 19% of cardiac arrests. Causes of ventricular fibrillation varied and include medical illness, overdose, drowning, and trauma. The electrocardiogram ventricular fibrillation. Ventricular fibrillation is chaotic depolarization of the ventricles. Mechanically, the result is an arrest cardiac pump function and immediate death. Ventricular fibrillation can only be treated by immediate defibrillation. If you consider ventricular fibrillation in a conscious patient, that you should look for a technical problem with the electrocardiogram.
VFib. And so in VFib, we see an absolutely chaotic rhythm with no rate, no discernible P waves, and obviously if there are no P waves, there's no PR equal. There's no clear evidence of a QRS or normal QRS complex, and of course if there's no P waves, then there's no ratio of P waves to QRS, and the rhythm is really not applicable because there's chaos in the underlying baseline. So what happens in ventricular fibrillation is that there are multiple ectopic foci in the ventricle, and these are firing off in different directions. And when two waves of depolarization run into one another, they cancel each other out. And so consequently, the ventricles become a quivering mass of myocardium. And when that occurs, there's no cardiac output.
The outcome in patients with ventricular fibrillation is better than in patients with asystole or pulseless electrical activity. An outcome may be further improved by prompt recognition and treatment of ventricular fibrillation. Cons. In a population of patients with known ventricular arrhythmia, individuals who had ventricular fibrillation were more likely to have underlying significant heart disease than patients with ventricular tachycardia.
We note risk factors associated with its onset. In other cases, it may be the result of uncontrollable factors like a family history of heart disease. Ventricular fibrillation is often seen after a patient has a heart attack, when there are extremely low levels of potassium in the blood, and it may develop in the presence of Wolff-Parkinson-White syndrome or during atrial fibrillation. Other non-controllable risk factors that precede the onset of VF include congenital heart disease, advancing age, and gender. Controllable risk factors include high cholesterol, high blood pressure, diabetes, smoking, alcohol abuse, stress, and certain medications. Chances.
You should apply an echo. After initial resuscitation therapy in patients with ventricular fibrillation is primarily focused on preventing the antecedent ventricular tachycardias. However, technical advances in both implantable and external automated defibrillators have made this device an important part in the managing of malignant ventricular arrhythmia. Thank you.